new plan, will we see an improve in care for inpatient units when people make the transition back to home and family lives? Is there investment going into that?
We're really delighted that these units are opening up much closer to home. In our long-term plan, we're developing more crisis services and more home treatment teams, and hopefully more crisis cafes or hubs or drop-ins. We're hoping to avoid some admissions. Where people need to be admitted, youngsters, we hope it'll be closer to their homes, and we hope that they'll be able to keep their links with their school or their local community and network family and be discharged sooner, because we're going to have intensive home treatment services available to support them at that wobbly sort of transition of step down from hospital to home again.
So I identify as non-binary, which is part of the LGBTQ plus community. And I know a lot of people, myself included, that have gone to a mental health professional and been scared to come out to them, and I feel that that can sometimes impact care. And I was wondering if there are any plans to sort of help professionals understand us and help us not feel judged by them.
It feels to me like society's now having the non-binary discussion much more. And I think we've a way to go yet, and I think that's almost certainly true of mental health services as well. But we are making great strides forward. We're determined at NHS England and in the sort of long-term plan that it's not just about more services, it's about better and different services. Better training, better awareness raising, more signals and cues for people that they're in a safe space. And we're determined to do that throughout the services we develop.
Amazing. Something that's in the long-term plan is something about expanding timely, age-appropriate support for children and young people experiencing a mental health crisis. In reality, what does that actually mean?
We know much more now about neurodevelopmental kind of milestones. Science now tells us that you're not fully developed in terms of your brain and therefore emotions until you're 25. The life challenges and your developmental milestones are all different. So we want to make sure we really tailor to the milestone and the individual. We're rolling out to infant schools as well, and also at the other end, colleges of further education and ultimately university. The timely bit is definitely about having the capacity to see more people so that there's not a waiting list. You know, this is not good. When people need help now, they need it now. So we really want to make sure that that additional investment means that people are seen much, much more quickly.